get this thing started. Thank you very much for joining us once again. Today is yet another weekend, and we have the Weekend Health Talk. I happen to be your humble host, Albesedo here. I do this weekly to help us reduce the level of misinformation, especially on social media pertaining to medical issues, where I get to be honored by inviting my colleagues, friends, to come share their expert knowledge to everybody. And you have the opportunity to ask questions as well. It's kind of like a free specialist consultation to those who are going to be joining us live. Even those who might listen to the recording on the YouTube channel, you can ask your questions and we will respond. Today we have an amazing gentleman. He's an academic. The guy no book. He's a shark. You understand? He's a specialist psychiatrist, a qualified clinical psychologist. Yes, and he's a senior resident. Yes, Ghana College of Physicians and Surgeons. And today I happen to have him join us to talk about sleep and sleep disorders. Please join me. Welcome, Dr. Richard De Asamoah. Over to you, sir.
All right, good afternoon, Dr. Sodo here. Thank you for inviting me and all the plenty of accolades that you've chosen to put on me today. So good afternoon, everybody. Today we'll be looking at sleep and sleep disorders. I'll just quickly share so that you can follow me. All right, so sleep is one of those areas that fall within the domain of psychiatry and mental health, but tends to be overlooked or ignored or not paid that much attention to, especially because most of us think of mental health or psychiatry as a very narrow range of disorders. Most of the time we think of psychiatry and all you think about probably is bipolar disorder or schizophrenia or any of those. But sleep is also within our area. So we'll discuss sleep and the problems with sleep. This will be how we go about it. So we'll start off by discussing understanding what sleep is to begin with. So sleep is a state of lessened consciousness and physical activity in which the brain is relatively more responsive to the internal than external stimuli. So when you are asleep, although you are less conscious, it does not mean that your mind is asleep. Your mind is still working, your brain is still working, but it's now more sensitive to internal stimuli or internal activities than the external world. Some of you remember some years ago, there was an advert from one of the phone companies that says that the average man sleeps for 25 years. Okay, that's taken from the idea that if you count how many hours you sleep in a day, in your lifetime, you'll be sleeping about 1/3 of that period. So if you average that, you live for about 75 years, then 25 of those years will be spent sleeping. That's assuming that you're actually having the standard 1/3 of your day sleep, which means that you're sleeping for approximately 8 hours thereabout. So why is sleep important to us? Why should we sleep? There are some of you who say that sleep is for the weak, but in fact, sleep is what makes you strong and it's for the strong. So let's look at the reasons why you should sleep. For physical restoration, you need to rest so that your body replenishes the energy it's lost. Okay, you've been working morning to evening, so you need to rest your body, you need to rest your muscles, you need to rest your mind so that you can go on the next day. To conserve energy, if you keep working and working and working and do not rest, you do not sleep, then you run out of energy and have major problems. For brain growth, so when you sleep during that period, there are various changes that occur in the brain that help with brain growth, which is very important for children especially, and for adults also. Now we're getting to a point in time in our lives and life cycle, lifestyle, where for many of us, we have very little sleep, especially our children. Recently, there's been news of how children wake up as early as 4, 3, join the bus by 5 a.m. and so have little sleep. And this, in the long run, has impact on their brain growth. Psychological restoration. So your mind, your mood, your emotions, your thoughts. Sleep helps with all that. And then to consolidate memory. Some of you have difficulty with your memory actually because you're not sleeping well. You're not getting the chance to consolidate your memory. You are preparing for an exam and you sleep you study the whole night till morning. You do TV, expecting that that would help you make up or pass the exam. Then you wake up in the morning and you sit behind the paper and you can't remember anything you've read because you didn't give yourself the chance to consolidate the memory of the things you've studied. So sleep is very important, even for exams. I have a policy that I sleep well before every exam, regardless of what I've learned or not learned, because I'd rather have a well-rested mind that still has retained a little memory that I can use to pass than to go with a tired mind with little or no memory that will struggle to remember and pass the exam. Emotional regulation. So you would find that sometimes you come to work or you get to work and you have colleagues who are so upset and always irritable and angry or seem sad. If you ask them, you find that many of them have sleep deprivation. They probably got home very late the night before, didn't sleep well, woke up early and had to come to work. Some on Monday morning come and are already tired because they went for funerals and family gatherings and other activities and go home like 10, 11 p.m., had little sleep, and by morning they're on the way to work. So they come and they are already ready to fight. Yeah, those are things that sometimes affect emotions and our mood. So we need to sleep well. Now, what are the stages of sleep? So although for everybody, the average person would think that once I close my eyes, I'm gone. They actually go through a number of stages. So the first stage is the first non-REM sleep stage, or non-REM stage 1. Here you have the person now transitioning between being awake to actually falling asleep. So that's where you begin to feel drowsy or sleepy and start dozing off. That lasts about 5 to 10 minutes. Then you have the stage 2, where you now start going more and more into sleep. And so your body temperature begins to drop, your heart rate begins to slow down. This lasts about 20 minutes. There are certain tests that we do, we call an EEG, that may show something called sleep spindles, but that's not relevant for our discussion today, so we won't go too much into that. Then by stage 3, that's when you're now entering deep sleep, or that's when you're entering deep sleep. Your muscles begin to relax, your blood pressure and breathing rates all drop. And this is where you are in deep sleep, when you're actually asleep properly. Then beyond this, you enter what we call the REM sleep, or rapid eye movement sleep. So the non-REM means non-rapid eye movement. So at the rapid eye movement sleep, your eyes actually begin to move rapidly from left to right. And here the brain becomes more active. So remember, I mentioned that being asleep does not mean that your brain is asleep. So during the REM sleep, your brain is more active. It is almost as active as when you are awake. Your body naturally becomes immobilized because at this stage you start dreaming, and we don't want you to be enacting your dreams. So the body is relaxed so that you do not act out your dreams and injure yourself. So these are the stages of sleep, and the disorders of sleep may occur at any of these stages or even before sleep. So we'll look at the various disorders when we get there. So how is sleep regulated? So as you can see from this diagram, there are a host of areas of the brain that are involved, and what we call neurotransmitters, chemicals that are released in various quantities and in various parts of the brain to regulate sleep. And so there's a lot that goes into sleep. That's why I keep telling you that sleeping does not mean that your mind is completely shut down or shut off. You are still actively engaged. How much sleep do we need? So for an adult, averagely 6 to 9 hours is good enough. For infants and very young children, up to about 16 hours may be required. And sometimes your requirement for sleep will increase. So when you're very active and if you are well yourself, you would need more sleep to restore your energy. When you are unwell, as I said, sleep is for physical restoration. So you need more sleep for your body to restore itself. Pregnancy is another time when you require more sleep. And when you're under mental stress or increased mental activity. So exam periods are actually times when you should be having more rest than being overly alert or active. Now, I'm sure most of you say, oh, but I can't, it's not practical. I can't have this much sleep, or I mean, I can do well on little. It's a very small percentage of the population that can actually do well on little sleep. But to be on the safer side, don't try to find it if you're the type, because you might end up having worse outcomes. And these are some of the things that happen if you don't sleep well. Irritability, lethargy, depression, concentration and memory problems. So some of you will go to the hospital and complain that you have malaria symptoms, when in fact what you have is sleep deprivation, okay? Because your body is not getting the rest that it needs. Now, when this goes on for a long time, you experience things like hallucinations, begin to see and hear things that are not there. Research has found that when you keep somebody alert and awake and keep them from sleeping for too long, they begin to have these kind of experiences and delusions. In fact, research in rats have shown that if you are deprived of sleep long enough, you can have physical symptoms like, or signs like skin lesions, as in rashes on and abnormal skin problems, weight loss, you waste or spend more energy, and may actually eventually result in death. So depriving yourself of sleep may actually be a means of shortening your lifespan or your days on earth. So let's pay attention to that. What are some of the causes of sleep deprivation? In our setting, I think the number one cause is stress. You live as far as Dodoa and you work at ministries or on the Spintex Road, someplace like that, Accra Central. So you always have to leave home early, you get home late, and you are always stressed. Children's homework, school fees, so on. Then as you close your eyes to sleep, and you can just see bills swimming over your eyes, so you can't even sleep. So stress is one of the major causes of sleep problems. Occupation. So for some, the kind of work you do requires that you spend long hours awake or are awake in the night, like health workers, doctors, nurses, pharmacists who run night shifts and so on. These things can cause sleep problems. Poor sleep hygiene. So at a point, we'll talk about sleep hygiene properly, but if you are using mobile phones and other devices at a time when you should be sleeping, noise or uncomfortable sleeping environment, use of stimulants like coffee before you sleep, even use of alcohol and other drugs, doing things like studying in your bed when you should be sleeping, then the quality of your bed and your mattress can also affect your sleep. Then there are sleep disorders, which are on their own and will require some form of treatment. You have the insomnias or hypersomnia. So whether you're sleeping too little or you're sleeping too much. You have the parasomnias, that's behavioral problems that occur during sleep. And you can have things like the breathing problems during sleep as well. We'll tackle these as we get there. Then have other mental health conditions that can affect your sleep. So sometimes the sleep problem you're having is a symptom of a mental health issue, okay? So that you are better off seeking help from the experts to manage your mental health problems so that you're able to sleep well. If you are anxious, you are having palpitations, you are having feelings of apprehension and concern, you may have difficulty sleeping at night. Okay, so that you need treatment for that, and that will improve your sleep. Some medical conditions like chronic pain, if you have a chronic back pain, for instance, so you lie down and you're in so much pain, I keep turning and twisting, that can affect your sleep significantly. Those are other areas that sleep problems or deprivation may occur. Heart diseases and respiratory diseases. So if you have, for instance, heart failure, and so your lungs are more or less filling with fluid, and so you lie down and you can't breathe, so you have to wake up intermittently throughout the night, then you have sleep deprivation and then have subsequent problems from that. So let's look at sleep disorders. So it's seen that quite a number of people experience sleep disorders each year. It's about 70 million people as estimated. I think that this is actually an underestimation if you're looking at global figures, because even in Ghana, there are quite a number of people with sleep problems. The problem is that we tend not to realize that we're having a problem, and so do not seek help. And even if we realize it's a problem, we do not realize that it's a medical problem that you need to see an expert for. So you may end up trying all kinds of things at home, which rather worsen your state. Things like self-medicating with drugs, trying to take alcohol to sleep, some over-the-counter drugs, sleeping pills, pain medications, all those things. And eventually rather worsen your state. Now, sleep disorders will affect the quantity or the quality of your sleep. So as I said, there are different types. There are a host of them. We may not be able to delve deep into all of them. I'll touch on more pertinent ones and then summarize a few others. So insomnia. So insomnia is persistent problems with falling asleep or maintaining sleep or poor quality of sleep. There are some people who may have difficulty falling asleep. Others may be able to initiate sleep or fall asleep, but may wake up intermittently throughout the night. So by the time they wake up in the morning, they don't feel rested. Or some may also sleep and within a few hours are up and cannot sleep again. So all these fall under the domain of insomnia or as a sleep disorder. And this tends to affect your social and occupational functioning. Imagine going to work daily without having enough sleep. You sleep only 2 hours at night and you have to go through a whole day of work. You can imagine at a point your functioning and performance will drop. And this affects approximately 30% of the population. But there's a study in Ghana that found that up to 54% of university students may be experiencing insomnia. So you can see that's a big issue that actually needs to be addressed. Now, how do we manage this? Or how do you treat it? The first thing I'd want to point out is that medication is not the first option. Okay, most of the time, either as health workers or as patients, we are in a hurry to go to medications because it looks like it's a quick solve to the problem, but that can actually create further problems. Sometimes all the person needs is education about sleep, getting understanding the stages of sleep like we are doing now, understand the changes of sleep patterns with age. So as we said, as you grow older, your sleep requirements may decrease. Then some education on their sleep problems that they have and what they need to do or they should do about them. And then sleep hygiene. Some may also need to be taken through relaxation techniques, especially those who are anxious, so they can calm down enough to fall asleep. Now, if these are not working and there's a need for medications, please always seek help from a qualified medical practitioner and avoid self-medication. Many people have gone down that track and ended up with serious addictions, okay? Trying to take some drugs to help you to sleep. And the next thing you know, you are so addicted that you are using more and more of it and you cannot sleep if you do not use those drugs. That is not the way you want to live your life. So on the other side of the spectrum, you have hypersomnia, where you are sleeping more than you should. So we said that adequate sleep is about 6 to 9 hours. I have somebody who's sleeping for 13, 14, 15 hours, or the person is sleeping excessively during the day. Okay, so it may not necessarily be that you are sleeping so much, but you are sleeping excessively during the day. And this can affect work that involves vigilance and concentration. Imagine sitting in an Uber and seeing that your driver is dozing off. That can be really scary. And the same way, if you are working, operating a machine at work, and you fall asleep, you could injure yourself or injure others. So sleeping excessively, especially during the daytime, is a major problem that needs to be addressed. So it may occur as sleep attacks, where the person has irresistible episodes of daytime sleeping. So you are talking to the person, or the person is engaged in work and suddenly just drops and falls asleep. Okay, and that, you can imagine, can be a major issue, a major problem. Then you have sleep drunkenness, where the person, when they wake up from sleep, they have this prolonged period of transitioning from sleep to being awake, and they may have this confusion about themselves till they are fully awake. Then you may have those who sleep excessively from throughout the night all the way into the morning and still be sleeping. And then those who may have excessive daytime sleep. So they may sleep well or enough during the day, in the night, but during the day, when they're supposed to be working, they end up falling asleep again. Any of these may fall under the umbrella of hypersomnias. Now, some of the causes of this may include insufficient sleep. If you're not sleeping well at night, you may end up sleeping more during the day. So that's if you have sleep deprivation or sleep debt, working for days with little sleep, at some point your body will give up and you begin to sleep where you shouldn't. Then we have neurological dysfunction, like brainstem problems and problems with the brain that may require medical attention. Some people may experience excessive sleep either preceding, as in just the days before their menses, or during the menses. Okay, so that also can become an issue and may require some form of treatment. So you find that at that period during the month or during your cycle, you have difficulty staying awake and sleeping excessively, but on other days you are okay. And then some also may experience hypersomnias as a result of disruption of their sleep. So you keep having your sleep interfered with at night, so you are not having enough sleep. And so during the day, your body gives up and you fall asleep. So for these, the management or the treatment again would involve identifying the specific reasons or causes for the poor sleep, the hypersomnia, and managing those. In some cases, we may need to do medications. And again, as I said, if you have any requirements for that, always talk to an expert. You may need to go through certain assessments that need to be done to identify the specific sleep problem you are having and managing those problems. Okay. Now, we'll look at another interesting area, usually an area that people find intriguing and can also be quite disturbing: parasomnias. These are undesirable physical or experiential phenomena that may accompany or occur during sleep. So you have unusual behaviors during sleep or physical activity. They tend to be bizarre in nature. So quite often, such people may end up being accused of witchcraft or being possessed by spirits, or it being a form of spiritual attack. Sometimes you may receive a diagnosis of some other medical or mental condition because of a lack of understanding of what's actually happening. So I'll just summarize a few and then we'll focus on some others. So confusional arousal, like I described earlier, is when the person wakes up and is still transitioning, taking a long time to transition between sleep and being awake. So they are disoriented, they can't seem to talk well in their speech, and they are slow. It may be common in children, it's much rare in adults, and usually as you'll be seeing very soon, that the treatment will involve avoiding sleep deprivation, avoiding use of alcohol and drugs like sedatives, and then good sleep hygiene. Sleep or night terrors. So you have people who wake up suddenly from sleep with a loud, terrified shout and anxious. It happens quite often in children, and they may soon go back to sleep. And by morning, they have no memory of what happened. In fact, if you even told them they woke up at night, they may tell you that you are lying. And this usually may be in patients who have, or people who have sleep deprivation, those who use sedatives. And so sometimes they're having withdrawal symptoms from the use of the sedatives. Some may also be from just poor sleep hygiene. So again, the treatment will be to manage these issues. If beyond them, there are still problems with sleep, or you're still having the night terrors or sleep terrors, then medications may be prescribed. And again, if medications are to be prescribed, it must be by an expert. A closely related disorder is nightmare disorder. It's quite similar. You may have the person also waking up frightened and anxious, and also maybe screaming. But most of the time, these people would have had a bad dream that they can recall. And usually they may not go away to sleep immediately. And even if they do, by morning, they still remember what happened in the night. It happens quite often in people who are experiencing some real life traumatic events or stressor. So for instance, children or even adults who have been abused physically or sexually or even emotionally may experience nightmares and have serious problems with them. The treatment here will be to, again, identify the causes. So if the person is having any traumatic experiences that they need to see somebody about, a psychologist or psychiatrist, that will help. Also practicing good sleep hygiene, and then avoiding stress and drugs that may be causing the nightmares. Okay, some medications can actually cause or be the cause of the nightmares. So you may need to talk to your doctor to either change or adjust your medications. Another similar one is nocturnal panic attacks, where the person may wake up from sleep with no obvious triggers and feel just very anxious and very uncomfortable. It may occur as part of a full panic disorder, and so may require treatment of the entire panic disorder, or maybe as a result of sleep deprivation and use of drugs. So I'm sure by now you are seeing a recurring theme here, that one major cause of most of these sleep problems is deprivation and then use of medications and drugs that you shouldn't be using. So again, psychotherapy, if there's an underlying panic disorder, medications may be used, but importantly, practicing good sleep hygiene may help. And then we come to almighty sleepwalking. If you've been in a boarding house before, it's likely you've come across some people who in the middle of the night may wake up, walk around the dormitory, even go as far as eating or drinking, and then going back to sleep. And in the morning have no recollection of anything like that. So it may involve complex behaviors like wandering, attempting to dress or undress, carrying objects, eating, urinating in unusual places, even as far as driving or engaging in sexual behaviors. So there are stories of people who realize that the food in their fridges are running out. They live alone or they live with other people and accuse the other people of stealing their food. Then they install cameras and find that it's the same person who wakes up at night to eat the food and then goes back to bed. Okay, and these complex behaviors can occur during sleepwalking. Now, sleepwalking usually occurs also as a result of deprivation. So when you are not having adequate sleep and the mind and the body is stressed, you can get to the point where you start having unusual behaviors like sleepwalking at night. And the risk with this is that sometimes injuries may occur. Imagine somebody sleepwalking and tripping down the stairs. They get injuries. As the person may not even remember what happened by the next morning. And if you wake the person whilst they are in the activity, they feel very confused and disoriented. Usually the approach to treatment or managing is first to protect the person from harm. So keeping items or objects that the person might harm themselves with, or if they run into at night, away from reach. Teaching them relaxation techniques to help them calm down and sleep well. Practicing good sleep hygiene. Sometimes there may be the need to give medications. So if you have somebody who is having this problem and is persistent, do not wait for a point where the person injures themselves before you get help. Okay, try and get help as soon as possible. Then sleep paralysis. This is another one that I think quite a number of people have experienced before. In fact, it's believed that most people experience it at least once in their lifetime. The accounts sometimes refer to it as mulunkum. So there's this frightening experience of being unable to move, either right before you go to sleep or just when you are waking up. And this may also occur due to sleep deprivation. But in most scenarios or most cases they occur, you find that the person has probably had very little sleep for a long time. And so good sleep hygiene, avoiding sleep deprivation may help. Some people describe that, if those who have it often describe that when they experience it, they try moving maybe one or two fingers or clenching their toes, and that's able to jolt them out of it. But if you experience this more often, maybe once might not be an issue, but if it's becoming a pattern, you would need to see an expert for an assessment and management. It can be really frightening. So the earlier I get help, the better. Now, you may have sleep-related cramps. I'm sure some of us have experienced this before. You, whilst asleep, you have this sudden painful tightness of your muscle, usually the calf, the foot, or the thigh. So more like muscle cramps occurring at night. It's so severe that it wakes you up from sleep and really very, very uncomfortable. Usually occurs sometimes if you have excess muscle activity before going to sleep. For instance, going to bed right after strenuous exercise. If you're not drinking enough water, in patients or in persons with diabetes, arthritis, may occur in pregnancy and in other medical conditions like Parkinson's disease. If it occurs just once or twice, you may not require treatment. But if it's happening frequently, you may need some form of treatment. Options include applying heat, massage, muscle stretch exercises, and occasionally medications. So as you've noticed by now also, there's a theme that medication in sleep is usually a last resort, unless there's evidence that it's a purely primary problem that is purely related to just the sleep abnormalities, maybe from some parts of the brain centers, and requires medications or treatment. I'm sure you're also aware of some people. So some of these words may look big, but once I describe them, I realize that you are quite familiar with them. Sleep-related bruxism. You have people who grind or clench their teeth during sleep. And this may be severe enough or frequent enough to cause injuries to their teeth. So the teeth may wear off or may actually even break. They may bite their tongue or even injure their jaw and jaw muscles. It quite often happens when there's also again sleep deprivation and various factors like medication use and so on. The approach to treatment is again sleep hygiene, removing factors that may be contributing to it, like poor sleep and sleep deprivation. Sometimes you may need to use bite guards at night. This should be only prescribed by qualified professionals. Please, if you have a relative, a friend, a sleep mate, or a partner who has this problem, do not try putting things in their mouth to keep them from chewing or biting their tongue or keep them from grinding their teeth. You may end up rather making them bite, break that thing into their mouth, swallowing and choking on them, or even causing more injury to their teeth. So if you have any concerns there, again, talk to the experts. So briefly, I'll go over sleep-wake disorders as well as I round up. So sleep-wake disorders are usually related to people having difficulty with aligning their sleep patterns. So sleeping when they should be awake and being awake when they should sleep. Common causes of this include jet lag. So if you are somebody who travels frequently, pilots in particular tend to experience this, and cabin crew, and then people who travel a lot for conferences and so on. So usually if you travel over time zones, about 1 or 2 hours may not pose a problem. But if you travel over, say, 5 hours, 6 hour time zones, then your body is already used to a particular sleep and waking pattern. Now you're in a new country or a different country, and your usual sleep pattern does not align with the sleep pattern in terms of the time zone you are in. That can be a problem. Shift work. So those who work shifts and end up doing night shifts. So you do some night shifts, then you do some day shifts. And so you keep disrupting your sleep patterns. That can also be a problem. Some people generally have irregular sleep-wake patterns. So it doesn't follow the usual pattern of being awake during the day and then being asleep at night. Then you have advanced sleep-wake pattern. Sometimes you have people who may sleep earlier than usual and they wake up earlier. So maybe you expect to sleep at, say, 9 or 10 and wake up in the morning. You end up sleeping like 5, 6, and then waking up at night. And although you have enough sleep and you are refreshed from your sleep, you are waking up at the wrong time. And you're sleeping at the wrong times. Okay. Some of them may not require any form of treatment. They may resolve over time. Some may require psychotherapy as a treatment. And then occasionally we may need to give medications to help regulate or correct the sleep patterns. Then another area of interest is sleep-related breathing disorders. Here we have people who have difficulty breathing or have abnormal breathing patterns during sleep. One common one is obstructive sleep apnea. It tends to be more common in males and obese persons. What happens here is that it's more or less like the upper airways collapse on each other or collapse during sleep. And so the person struggles to breathe and may be difficult, may end up waking the person and giving the person poor sleep quality. For persons who are experiencing this as a result of problems like weight, excessive weight, lifestyle changes like weight loss, avoiding alcohol and smoking may help. Some may require devices like the CPAP or other tongue retainers and so on to open up the airways whilst we sleep. Occasionally, surgical treatment may be required. And again, so you have to go for an assessment for us to determine which should be the best in your case. It may occur in children as well. And usually for children, it may resolve as they grow older. And again, the CPAP and other devices may help. Snoring can be an isolated disorder on its own, where there isn't exactly a blockade, but a full blockade, by maybe a partial blockade. And so the air rushing over the structures in the upper respiratory area causes a turbulence that causes that snoring sound. But it may be a symptom or one of the first symptoms of sleep apnea. So if you have a sleep mate, a partner who is snoring excessively at night, it's not just disturbing to you. It could be that it's an early sign of a major problem that you need to have addressed. And it's important that if it's continuing, you have the person or advise the person to be assessed to find out what is the cause of this so that the appropriate treatment can be given. Okay, it's sometimes we regard or take these things as jokes, we laugh about them, and then we move on. But the person may be having a serious problem that he needs care for. So I'm sure with this, you've been able to go through most of the sleep disorders and explain them. Our take home primarily will be focused on the sleep hygiene, things that you can do to help improve your sleep so that you have better sleep quality and have less sleep problems. There are two parts. The first part is to establish a good sleep habit. So have a regular bedtime and wake up time pattern and avoid changing this by more than an hour. So your sleep and wake patterns should be consistent so that your body gets used to that pattern, so that at every, say, if you sleep at say 10 o'clock, at 10 o'clock, you know it's sleep time, you go and lie down and you sleep. Try and maintain this pattern, okay? Try and control the environmental factors as much as you can, like light, noise, temperature. So if you realize that you have difficulty sleeping with lights on, you are better off putting your lights off when you're going to bed. Once you know it's sleep time, you put off your lights and you go to bed. Regulate the temperature in your room. If it gets too cold at night for you, you don't want to use a blanket or a cover cloth. If your room is too warm and you want to use a fan, something, that's okay. Then you should have a wind down time. So about 30 minutes to an hour before sleep that you use to distract yourself from the day stress and gradually put yourself in a sleep mood. So you may be reading, watching TV, listening to music. This is not the time to listen to heavy metal music or music that is overly alerting, or watching a series or a movie that requires a lot of mental work. So that's not time to watch a detective movie and try to figure out who is guilty and who is not. Also, if you are reading, you read something that will calm you enough to sleep, not things that will make you anxious. So that's not the time to read about Ghana's economy. Then avoid stimulants like coffee, Coca-Cola, and getting to the evening. Okay, because from 4 p.m., avoid these drugs because they can affect your sleep significantly. Do regular exercise, but not too late at night. So if you start exercising at 9:30, your body and your mind is alert and you expect to fall asleep at 10 or 10:30, you may struggle to sleep. Sometimes warm milk helps to sleep. It contains certain chemicals that are essential for some of the chemicals in the brain that help you sleep. So it's good to try having warm milk if you're having sleep problems at night. Sometimes you're having difficulty sleeping at night because you sleep too much during the day. So you may want to avoid naps during the day, or even if you are going to have naps, it should be early in the afternoon and as much as possible, not exceed 40 minutes. Because the more sleep you have during the day, the more difficulty you may have sleeping at night. Then the next part is stimulus control. So one of the things that you should do is that you restrict your bed for only 2 things, for sleep and sex. This is very important, so that anytime you go to your bed, your mind and your body is tuned to falling asleep. Okay. Avoid using mobile phones, tablets, and other devices in bed. It's become a pattern of lifestyle amongst many Ghanaians now, and it's the reason why you struggle to sleep. Sometimes somebody comes to see you, doctor, I can't sleep at night. And then you start taking a history or taking details and find that this person goes to lie down and is playing on their tablet or their phone for hours. And the question is, how do you expect to sleep when you are on your device? Also, the devices tend to emit spectrum of light that stimulates your brain, so it makes it difficult for you to sleep. Now, if you go to lie down and sleep doesn't occur within about 10 to 20 minutes, if you have the option of going to another room, you can do that without turning on the lights. Sometimes a change in environment, a change in room may help you feel sleepy again, and you can come back and try sleeping when you are now feeling sleepy. So as I said, establish a regular wake time and not vary it by more than an hour. Okay, so if you decide that you're waking up at 5 or 6 every morning, you try to maintain that sleep and wake time and not vary it. If you keep sleeping at 5 or 6 and you now start setting your alarm to wake you up at 3, you are likely to start having sleep problems because of the poor sleep hygiene you are engaging in. Okay. So in rounding up and concluding, we have established that sleep problems are common and they are mostly due to stress and poor sleep hygiene. And sometimes due to other mental health disorders or physical causes. And actually most are treatable by practicing good sleep hygiene like we've discussed and avoiding sleep deprivation. Now we've also learned that we should avoid self-medication as this may worsen the sleep problem or cause new problems for us. Now also you should know that help is available. And so please and big please get help. Do not suffer in silence. Do not seek help from the wrong sources. Talk to an expert and get help. Thank you very much for your attention.
Thank you very much, Dr. Deasama. We appreciate the lecture. It's been thorough. Everything that we need to know about how we fall asleep and what things could possibly go wrong has been dealt with in this amazing lecture. Thank you very much. And for those of us who joined us late, don't worry. The recording of this amazing lecture will be uploaded on our YouTube channel. I've sent a link in the chat box on Zoom. For those on YouTube, just click subscribe and stay tuned. The recording will be made available. Now it's time for questions. Please, I know a lot of questions have been answered already through the lecture, but if you still have any questions, please feel free, put in the chat box or the comment section, and Dr. Richard will kindly help us solve it. Somebody was laughing and sent me a message that you said the bed should be reserved for sleep and sex. Is that doctor's prescription?
Yes, that's the doctor's prescription for you. Please, the bed is only for sleep and sex.
Okay, all right. Well noted. Thank you very much. All right. Okay, so if you have any questions, please feel free and put in the chat box in the comment section, and Dr. Richard will gladly answer all questions for us. We have some few minutes left for questions and answers. Thank you very much. I enjoyed the lecture. I learned a lot. Yes, the stages are 4, non-REM are 3, REM is 1. Okay, somebody's asking, why should we avoid anything except sex? I knew this was going to come up.
Okay, so you are avoiding other things because as you engage in other things on your bed or in your bed, your mind and your body is tuned to doing other things. And so the bed does not become the place of rest as it should be. So for instance, if you study in your bed, if you work on your bed, then it gets to a point where your mind is no longer tuned to just being sleeping when you go to bed. So your mind is not active because your mind is not thinking about work, okay? And it also means that sometimes if you make it a lifestyle, anytime you go to bed, you're going to bed with a device for you to continue your work. And as you continue the work, you have difficulty. Before you realize it's 12, it's 1. You go like, hey, I've worked tomorrow, then I want to go and sleep. By morning, you are tired and you are not able to work. Okay, so that's the reason why you reserve the bed for only sleep. If you want to know why it's reserved for only sex, I'm sure there will be a session about sex and sex-related disorders, and the expert there will touch on that as well.
Yes, we have a session about sex and the sexual the disorders that comes with it. Now we have another person asking, Doc, sometimes I realize that even though I am sleeping, it looks like my mind is still working. I can eventually remember all my thoughts. What should I do?
Oh, you and I have similar problems. So there are people, I don't know why, but there are some people who seem to, even when sleeping, are able to sort of know they are dreaming. So some people have, we call them lucid dreams. So there are people who sleep and can actually tell that they are dreaming. and may even be able to regulate what happens in the dream and so on. And yes, it can affect your sleep pattern. For some people, it may occur just once in a while, so may not really require some care or treatment. But if something becomes disturbing, such that maybe it's affecting your sleep, then you need to talk to an expert to help you with that. Sometimes you're also having that because you are going to bed with a lot of worries, a lot of thoughts. So even though you should be sleeping, and that's where sometimes the waking up with the panics and all those things may occur. Because really you thought you were sleeping, but your mind is still worrying. So it's not at rest. Okay. So that although the mind is active at night, you should be active doing things like being more sensitive to internal stimuli, being dreaming, and rebuilding itself. So if you find that at night you are sleeping and you are worrying excessively, it may be a sign. In fact, it could be a sign that you need to start talking to a mental health expert to help you deal with the challenge that you're having during the day. Okay, so I can have a restful night.
All right, thank you very much. So the young man made a follow-up. He said he's asking a question: does sex improve sleep, or distract people from sleep?
I'd say it depends on the person and it will depend on the time. Okay, for some people, in fact, we've had a lot of women complaining that their husbands don't talk to them after sex. As soon as they finish, then they fall asleep. So maybe for those people, it means that it's helping them sleep well. Okay. Some people too may be regarded as a form of exercise that may make them too alert afterwards, and so you may struggle to sleep. Again, if you are being woken up, if you sleep at 10 or 11, and you're waking up every 2 to 3 hours for sex, it may disrupt your sleep, and then may also be a problem during the day. So maybe an issue that you may have to discuss with your partner so that you find good times. So the best times from my readings and what you've seen so far is that either before you all go to bed or just when you are waking up, okay, so that does not disrupt your sleep. Yeah.
All right, so doctor is advising if you want to have sex, have it before you all go to sleep or just before you all wake up. That's again doctor's prescription. Thank you very much, doc. All right, please, if you have any questions, put in the chat box in the comment section. Dr. Richard is answering questions. Feel free and put your questions in the chat box in the comment section so that Dr. Richard can answer all for us. Somebody was asking a question about if you're moving from country to country. Dr. Richard touched on that in terms of jet lag. And he explained to us that some of them resolve without any medications. So sometimes when I do that, I just sleep for some time. And when you wake up, your body will somehow, adjust to the new environment. But there are people who actually, so doc, in that regard, let me ask, there are people who are globetrotters. They travel a lot within different time zones. What would you advise?
So for people like that, especially if you are going across wide time zones, I advise that you talk to a mental health worker to develop a plan for you, tailored specifically for your patterns, so that you do not have too much sleep deprivation. Okay, so you talk with your experts. They will develop a sleep schedule or pattern that will help you over time, and then have regular reviews of these, so that as your travel patterns change, your sleep patterns can also be adjusted to make up for those changes.
Yes, that's very true. I have someone like that who always consults me anytime he's about to travel, because he travels quite across wide time zones. The reviews I'm getting is this has been a very insightful session. Thank you for the lecture. I'm enjoying the session. But I want to ask questions. Dr. Richard is quite a busy man. He's going to go off very soon. Please ask your questions quickly. If you have any question, put in the chat box in the comment section, and Dr. Richard will gladly answer for us, please. And he kept emphasizing something, which is if you have any of the problems he enumerated, seek help from qualified professionals. The aim of this Weekend Health Talk is partly to help you understand the medical issues from the expert, and for you to know that there is help for you to seek appropriate help. That is why we are doing this. We may not necessarily prescribe any medications here, but if you have any problem, seek help. If you link up with me or anybody, any doctor, any qualified doctor, you should be able to get the appropriate referral to get the appropriate help that you need. If you have any question, please put in the chat box. Okay, so somebody is also asking, for professionals who work day and night shifts, what will you advise?
So if you work day and night shifts, I mean, we've all done it before. Some of us even still do it sometimes. So if you work day and night shifts, the important thing is to plan ahead. So most of the time, your schedules are drawn maybe for a week, a month, usually for a month. Look at the schedule, okay? Then see which times that you can catch up with the sleep that you've lost. Sometimes the problem is that you take a lot of night shifts on yourself because you probably want to go and do some other things during the day and so on. And that's where usually the problem starts, because now you are mostly up throughout the time, because when you should be sleeping, you are working. When you should be resting, okay? So you have to look at your schedule ahead, plan your sleep times. And usually for the sleep shift problems, when the shift is restored, I mean, you are restored to regular, maybe morning shift or afternoon shift and so on. That also resolves on its own. You may not need any medications or any special problems. But if you find that it's becoming distressing, that in your particular case, the back and forth with the shifts is affecting you significantly, you should talk to your supervisors so that the shifts can be adjusted to help you. Okay, so that if you're going to give them a consistent shift, if maybe for a whole month or for a particular period, you're doing only day or only afternoon or only night, so I don't keep switching between cycles, that may be of some help as well.
All right, thank you very much. Just know that for every problem, there is a solution. Just start from there. For every problem, there is a solution. Then you go ahead looking for that particular solution from qualified personnel. Somebody wants you to talk about sleep talk. Sleep talk.
Okay, so it's I didn't zoom in on this because it's also part of the parasomnias. Okay, it's also one of those things that you may experience as behavioral problems. Occasionally may not be a problem, but if it's something that can disturb your sleep or disturb the sleep of those around you, okay, so then you may need to get help. Again, one of the major causes here, as I've said, is sleep deprivation. Okay, so we are not sleeping well. The little time you get to sleep, your mind is still quite disturbed or stressed. And so sometimes what happens is that the person may be talking because they are saying what is happening in their dreams or something like that. But importantly, if it's something that's happening regularly, talk to an expert. Let's see if there's a need to adjust your sleep cycle or sleep patterns, or there's a need to start you on some medications when necessary. Okay, it can be quite disturbing, especially for the other person in the room with you if you are sleep talking.
All right, so the same person who asked about sleep talking is saying that her husband wakes up in between sleep, talks, accuses her wrongly, and I'm sure goes back to sleep. What would you advise her on in that situation?
So if it's something that's happening often or happening frequently, it means that there's probably some problem with your husband's sleep pattern or sleep issues. So you should talk to someone. Let's find out what the problem is. You see, there are, as you've seen already from the presentation, there are 1,001 things that could be happening. Okay, so we have to find out what specifically is the reason for him. Okay, it could be just that he's not sleeping well enough, or it may be a sign of a more serious sleep problem that needs attention. So you should get help. He may not recall and so may not agree with you. It may help to record him once and show it to him so that he sees that, I mean, it's something that's happening regularly and so he should get help. Actually, one of the things that we advise people to do when somebody has a sleep-related problem is actually take a recording. Again, it gives us an idea of what's actually happening and what the person is experiencing. You see, because quite often, some of them, the person may wake up and not have any memory of them, especially the parasomnias. Somebody will get up and eat everything in the fridge and come and sleep and cannot remember that they were even up and even accuse you of eating their food. So the same way, they may be waking up and making accusations and all that. And you can see that for you, it might in the beginning, it may seem like, oh, it's understandable when you're understanding it, but it can affect your mental health. Every time husband wakes up and accuses you at night of things, you may yourself be needing help soon if you don't take the right steps. Yeah.
All right, thank you very much. And yes, like you said, he might not even remember the accusations that he's leveled against you. Somebody is saying that my partner snores too loudly, but says it runs through the family. It didn't used to be frequent, but now it's every day, and it disturbs me a lot. What can I do?
Yeah, so the sleep apneas, they can even run through, they can also run through families. So the fact that it's something that's running through the family does not mean that it's normal. See, sometimes you make there's a misconception that if something is genetic or something is familial or it's in the family, then it may be, we should take it as normal. No, it may still be evidence that there's a problem. So you may be the one to start breaking that cycle in the family. So you should get help. Because as I said, snoring too much at night, it may not just be the snoring. It may actually be that the person is having serious problems in their throat or the respiratory tract that may be require urgent medical care. So please, although he may think that it runs to your family, so it's normal, he should get help. Let the doctors or the experts tell him whether or not this is a normal snoring.
All right, thank you very much. Thank you very much. All right, thank you very much. Any more questions? Any more questions that any of you may have? Please feel free. This, like I said, is like a specialist free consultation. Feel free to put your questions through and let Dr. Richard help you here. Ruby Jade is asking, please, I can't sleep at night, but during the day, I'm feeling sleepy. Is it a problem? Yes, Ruby, it's a problem.
Yes, it's a problem. Yes, it's a problem. You should be working unless you are a night shift worker, you should be working during the day and sleeping at night. So if your sleep pattern has shifted like that, you should seek help. Usually, you may not require medications. There are behavioral therapy approaches that can be done to gradually shift your sleep into the night. Okay, so it's very possible to get help.
Yes. So, like, we are just helping you to understand why certain things are happening. You know, African, we ascertain everything to spirit and superstition, especially the parasomnias. They will label you a witch, a wizard right now. So we are letting you know these things are real, so that you seek help from appropriate professionals. All right. Okay. Any more questions? Please feel free to. We have just 1 more minute to allow Dr. Richie to go. 1 more minute. Please put your questions in the chat box in the comment section. And for those who joined us late, just so we are fair to those who joined us on time, the recording will be shared on the YouTube channel. Okay, a question has come through. One time at age 10 years, I woke up at night and I realized that everything turned into a moving snake. No one saw it as I did. What happened? Okay, I'll allow Dr. Richie to say that.
So there are one thing I can think of that could be happening is what we call an illusion.
Yes.
Okay. When you are just waking up from sleep, or you just woke up and you are still a bit disoriented and confused, things can begin to look like things that they are not. Okay. So threads, ropes, belts begin to look like a snake. If there's a white curtain below, it may look like a ghost, and so on. So what you experienced medically we refer to as an illusion. Okay. And it's not a problem. It's just because you woke up confused and disoriented at that time. Okay. And it passed. So it's not a big deal. Okay. Yeah.
Yeah. All right. Thank you very much, Dr. Richard. The recording will be shared on the YouTube channel. So I've shared the link again in the Zoom chat box. If you have not subscribed yet, please kindly subscribe. Just 2 seconds. Subscribe to the channel so that you can benefit from the previously recorded lectures, and of course the future ones, as well as today's lecture as well, especially for those who are joining us late. Thank you very much for your subscription and of course your sharing of the content, because we want to reach as many people with expert medical knowledge. Every week or every 2 weeks we have different medical specialists who come here to share with us expert knowledge for us to know why certain things happen the way they do. We are growing and we've grown past 1,050. We started from 2. With your help, we are growing, and I want to say thank you all very much. I appreciate you all. A question has come through. I become restless if I don't nap. Should I be worried?
Okay. So the simple answer to that is that we would have to assess further. Okay. If you have maybe a nap, like as I said, sometimes I have about 40 minutes to an hour nap during the day. That is fine. Okay. But I'm also wondering what time of you are referring to. That if you don't nap at what time, do you have problems, or do you start getting restless? Okay. It could be that there's something going on that we need to assess. It could mean that you are not having enough sleep at night. So during the day, you start getting sleepy, and then you are now feeling restless if you don't have the nap that you want to have. Okay, it may mean that you now have to look at your sleep pattern and work at sleeping better during the night, so that you don't have to have naps during the day or get restless if you don't. Yeah.
All right, thank you very much. If I should just recount what you said from the very beginning, most of the sleep issues, stress is a big underlying factor. Exactly. Would I be right if I say so, Dr. Richard?
Exactly. For many of those who report with sleep problems, you go in and find out that the underlying problem is stress, or that they are not practicing good sleep hygiene. And so once you start working on those, their sleep becomes good, and you don't have to do anything else or even give any medications. That's why medication is a last resort. When we are finding out that everything else is okay and it's just problems with the brain that are causing it, much of the time, just managing stress is enough to resolve sleep problems.
All right. Thank you. So what would be your final advice to people who work under very stressful conditions, very, very stressful conditions at work? What would you advise them?
As you said at a point, there is a solution to everything. Okay. So start thinking through it. As I said, one of the advantages that I find that really helps is anticipation. So you are aware that maybe for the next month or so, there's going to be more work, or you're going to be working at night, or you're going to be doing this. Quickly start coming up with a plan. If you are struggling to come up with a plan yourself, talk to an expert. Okay, don't wait till it gets out of hand before you seek help. Let's look at how we can support your sleep throughout the stressful period. Okay, and importantly, practice the sleep hygiene steps. Sometimes that alone might even be enough to help you deal with the stress and problems with sleep that you may be experiencing because of the stress. Thank you.
All right. Thank you very much. So 2 last questions just before we go. One is asking, if somebody sleeps while standing, what could be the cause? I'm sure she joined a bit late, so just for the purpose of everyone else. Somebody sleeps while standing, what could be the cause?
If you are sleeping while standing, again, so it could be one of the hypersomnias. So you are sleeping excessively. It is not the usual thing to be sleeping while standing or working or doing something. So get help. Okay, let's find out what's happening while you are sleeping. As I said, it could be due to sleep deprivation, or it could be a sleep disorder actually happening with you. And so you may need some treatment for it. So it is not the usual thing to be sleeping while standing. Okay, so get help as soon as possible.
Last question says, I want to pray at 12 midnight every day. How should I manage that without depriving myself of sleep? This is very important because I'm happy it's been brought up. So there are people who sleep maybe 8 or 9 or 10 and wake up at 12 midnight to pray to 1 or 2 a.m. and then they want to ask you, what will be your advice so they don't get these sleep issues? Please, they need to hear it from you.
So if you are going to be waking up at a particular time to sleep, to pray, you realize that we said that you need roughly 6 to 9 hours of sleep in a day, which means that now you have to find a way of planning your sleep so that those times you're waking up to sleep, to pray, does not deprive you of sleep. So if it means you sleep a little earlier, so I can have a little more sleep and then wake up to pray, you can do that. If you also want to shift that prayer time to, say, a day when you may not have to go to work early the next morning, so that you probably pray and then sleep a little more into the day, that's also possible. But as much as possible, make sure that even though you are waking up, it may not be able to just to pray, maybe waking up to do other things that you want to do. Make sure that eventually the total amount of sleep you are having in a day, as much as possible, between the 6 to 9 hours. And observe your sleep quality. So something called sleep diary. You may do a sleep diary or journal and see how well you are sleeping. If you find that in spite of all this, it's affecting your sleep, then you may not be the right candidate to be praying at 12 a.m. And besides, God hears you whatever time of the day you pray. So if you have to now shift your sleep, your prayer time to a time that is more convenient for you as a person, then you do so. Okay. Yeah.
God hears you any time of day that you pray for your own health. If you are supposed, if it's not good for you, it's not the best for your health.
Exactly.
Try to, So my question to you, Doc, is this: if you sleep continuously 6-7 hours, is it the same as if you sleep 3 hours and 1 hour?
It varies again. So as much as possible, the continuous 6 to 9 hours is preferred, is the best. Okay, as much as possible, aim for that, right? If you are going to make any adjustments, it shouldn't be a very wide. So something like if you're going to maybe 5 and 2 or 6 and 1, that may still be acceptable. But if you do it in very short bits, you sleep for 2 hours, you wake up, you sleep for another 2 hours, you wake up, you sleep for an hour, those interruptions will affect the quality of your sleep. And so you would have slept 6 hours to 7 hours, but you slept, it's been so interrupted that it's not continuous enough to actually qualify as a good sleep pattern. Okay, and then you still have sleep problem. So as much as possible, have them all together as one sleep. Yeah.
Yes. Thank you very much. It's been an insightful presentation. I learned a lot, and most of the audience also gave very positive feedback whilst the presentation was going on. It's been very insightful, very detailed, and we learned a lot. Sleep problems is big. It's very, very big. It may be the only symptom you may have that may be a red herring to a major problem you may be having. And thank you so much, Dr. Dea Asamoah, for availing yourself to lecture us, give us this presentation. Please, all of us, join me, say a big thank you to Dr. Richard Dea Asamoah in the comment section, in the chat box. Please join me, say thank you, Dr. Richard. Thank you very much. We appreciate your time. We appreciate your knowledge shared with us. Join me, share it in the comment section, in the chat box. Thank you, Dr. Richard. Thank you, Dr. Richard. Let him see it and let him feel appreciated, because not everybody has the free time to spare these days, right? As you all heard rightly, stress is one of the major underlying problems when it comes to sleep issues. Stress could be from anything, from your work, from home, from finances, from relationships, from a lot of other things. Stress. So if somebody makes time to, share such amazing things with you, we need to, appreciate you. Thank you very much, Dr. Richard Dea Asamoah. We appreciate you. Thank you
also for having me.
Thank you.
Yeah.
And once you've come once, we are like Oliver Twist. We will be calling on you once again very soon.
That's fine. No
Come
problem.
again to share with us on any topic that would be very helpful to all of us. We appreciate you. Thank you very much. And to the rest of you for joining, making time, sharing the link, and subscribing, I want to especially appreciate you. Those who join us late, the recording as usual will be on the YouTube channel. I appreciate you. And once again, it's been a pleasing pleasure serving you all. Let's all enjoy our morning, afternoon, evening, based on when you are listening to this recording or wherever you are reaching us from. Thank you very much.
Thank you.